आपको ऊपर मैसेज आ गया होगा।
2 minutes रह गए जी, आवाज आ रही है जी। 2 minutes to go।
जी
हाँ जी, that's good।
आपको ऊपर लाइव आ गया होगा।
लाइव, yeah, that's okay।
हाँ, मैं YouTube ऑन किया, होम पे हूँ मैं।
हाँ जी, YouTube पे आप ज्वाइन कर सकते हैं अभी हम जी।
हाँ जी, YouTube ओपन है। हाँ जी,
ठीक है, ठीक।
कहाँ पे है? मैं YouTube पे गया हूँ, can't see it।
ठीक है, तो YouTube पे आ रहे हैं जी लाइव स्ट्रीमिंग। This webinar is being recorded. Continue. So I will say continue. Yeah, that's okay।
Sorry, I can't see it on YouTube।
नहीं, YouTube पे आ रहा है। There are three people watching as well।
Okay, so recording is also there। So what's the time now? So 1 more minute to go, so then we'll start।
I'm going to switch off my camera।
Go. So link not working. There's a message coming on from
yes।
So it's not working for webinar।
There are 5 people already on YouTube। Which
Amar,
link?
I can't see on YouTube. It's saying that this video is restricted. Please check the Google Workspace administrator।
नहीं, it's a public। पब्लिक स्ट्रीम। मैं आपको एक्चुअल लिंक भी भेज देता हूँ।
मैं दोबारा भेज रहा हूँ सदरान को भी, ताकि वो
तो तमीम साहब आप ना वो कैमरे के सामने से हट जाएं, क्योंकि YouTube पे आप लाइव कुछ बोल रहे हैं और कुछ सुने नहीं आ रहा है किसी को भी। आप अगर बोलना है ना हट जाएंगे या फिर ना वहां से अल्हम्दुलिल्लाह स्टार्ट हो गया। अब बिस्मिल्लाह करते हैं। 7 o'clock हो गए। बिस्मिल्लाह।
ओके, अस्सलाम वालेकुम, औज़ु बिल्लाहि मिनश शैतानिर रजीम, बिस्मिल्लाहिर रहमानिर रहीम। In the name of Allah, the most gracious, the ever merciful। Welcome to the webinar on COVID-19, benefits of vaccination and impact of lockdown on mental health। I begin today by acknowledging the traditional custodian of the land on which we are gathered today. Wherever that may be for you, I am currently on the land of the Dharawal people। I would like to pay my respect to their elders, past and present, and I extend that respect to any Aboriginal and Torres Strait Islander peoples here with us today। I would like to first give a brief introduction to Humanity First for our viewers। Humanity First was first established in 1995 in the UK, and since then Humanity First is a non-political, non-religious, and impartial international relief and development charity। It provides aid based on necessity alone, irrespective of caste, creed, color, or religion। There are 2 main focuses of Humanity First, which are disaster relief and human development। Humanity First also works in partnership with many international and local relief organizations। We are funded by the volunteer contributions of individuals and private sponsors। All of the aid workers and management in Australia are unpaid volunteers। Now I would like to introduce the presenters and panelists। Today we have 2 presenters, Dr. Ibrar Rahman Chugtai Sahab, he is epidemiologist and senior lecturer, School of Population, University of New South Wales. Welcome, Dr. Chugtai sir.
Thank you.
Second presenter will be Dr. Tahir Babar Saab. He's a senior medical practitioner, Bentley Hospital, WA. And his background is psychiatry. He has a very good expertise in mental health. And then there are panelists. Among the panelists, I've got Dr. Amar Mahmood from Tasmania. He's a senior GP, currently practicing in the Tasmania. And other Dr. Muhammad Ashraf Saab, he is from Shepparton, Victoria. So his practice is in Victoria. So he's a very senior and knowledgeable GP. And I welcome all our panelists and presenters, and I welcome all the viewers who are joined just now. And my name is Dr. Muhammad Muhammad Tanveer Arif. I'm a chairman, Humanity First Australia, and I'm also a principal GP in Dapto, which is in the Wollongong City Council area. So with that, we start with our first presenter. May I invite Dr. Ibrar Chugtai Sahib to present. His topic is on COVID-19, especially Delta variant and controlled measures. Dr. Chugtai Sahib, please.
Thank you, Dr. Arif. Amar, can you start presentation?
You carry on.
So can you see my slides?
Yeah.
Thank you. Thank you, Amar. So as you know, as Dr. Arif introduced that my name is Abrar Chugtai. I'm currently working as an epidemiologist and senior lecturer in School of Population Health, University of New South Wales. And I'm also currently working with Health Department on COVID response as well. So COVID-19 is not a new, we can say that only pandemic. So in the history, we have seen many epidemics and pandemics. So for example, some examples are plague, smallpox, which killed more than 500 million people. Then we have influenza pandemics as well, particularly 1918 influenza pandemic, which killed around 50 million people. And then we have small epidemics as well, like, SARS, MERS, influenza, Zika, Ebola. And currently now we are facing severe acute respiratory syndrome, this one, which is called COVID-19. Next slide. So coronaviruses, there are many coronaviruses. So SARS coronavirus 2 is just one of them. This is a newly emerged virus. So even other coronaviruses are circulating as well. Like these are RNA viruses. Most of coronaviruses are originated from animals. So at least 4 seasonal coronaviruses are circulating, which cause common cold. And these are circulating since last many years. Then in 2002, SARS coronavirus 1 emerged in China. And around 10,000, around exactly 8,000 people died due to that. And then MERS coronavirus as well, which originated in 2012 in Saudi Arabia. It's currently circulating as well, and the host is mainly camel hair. And now we have seen this SARS coronavirus 2, which emerged from China in December 2019. Next slide. So although we know that the first case was reported in December, but many studies shows that like the samples, blood samples collected from routine blood samples tested retrospectively showed that initial cases probably were somewhere in September, October 2019 as well. And so the name of virus is SARS coronavirus 2 and name of disease is COVID-19. It mainly transmitted into human from bats through an intermediate host, which we exactly don't know, but some studies show that probably it's pangolins. Transmission of coronavirus is through direct contact and through coughing and sneezing, like when somebody is coughing and sneezing. So it's small. Can you go back, Amar? Previous slide. So when somebody cough or sneeze, so some small droplets are discharged, and if somebody else inhale those droplets, so they can be infected. But there is some evidence for transmission via air as well, particularly with this Delta virus, which I will discuss in coming slides. Symptoms are from mild to severe, and around 25 to 40% cases are asymptomatic as well. And that is the reason it is very difficult to control coronavirus, because many cases are asymptomatic. They don't have any symptom. Common symptoms are fever, cough, tiredness, muscle pains, but in severe cases, they may be breathing difficulty and chest pain. Next slide. So here you can see some data, and as of August 21, so globally more than 250 million cases has been reported. And this is not actually, we can say exact number, because we know that the reporting is very poor in developing countries. So many cases are not being reported. So actual number will be much, much higher than this. So, so far around 4.4 million deaths have been reported. And again, this number is highly underreported, because many deaths from African and Asian countries are not being reported properly. So actual number of cases must be very high. And most cases that deaths are reported from 3 countries: India, UK, US, and Brazil. In Australia, we have less than 50,000 cases, and we're quite lucky actually. We managed this pandemic quite well, and less than 1,000 deaths has been reported so far. Next slide. So here you can see the age distribution and for cases and death, and this is very important because I want to show you that male-female distribution is similar, but you can see that there is a kind of some people believe, particularly young people believe, that coronavirus is not a problem of youth. Actually, this is they are infected, although that in the bottom graph you can see that number of deaths are higher in the elderly people. So coronavirus is affecting younger people as well, and you can in graph you can see that from 20 to 29 is the highest rate of coronavirus, and then 30 to 39 and then gradually it decrease. But unfortunately, the death rate is very high among elderly people due to pre-existing medical illness and the other issues. Next slide. So here is, we know that the main strain of was started from China, but now we have seen many new variants as well. We call it variant because viruses are continuously changing itself. When, for example, when virus enter into your body, so in your body it replicates, and generally in one body more than around billions of copies of new virus are produced. So because whenever virus replicate, there is always error. So due to that error, new strain might emerge. So that is the reason we have seen some new variants and new strain of coronavirus. So far there are 4 variants of concern. Variant of concern means that these variants are high risk, and there are many variants of interest as well, which are more than I think 7 or 8 as well. So initially, alpha virus was alpha variant originated from UK, then beta was from South Africa, then gamma, and most importantly, delta from India due to high circulation in the India. Next slide. So delta variant is highly contagious, and some studies shows that it's 50% more transmissible than the alpha variant, which was in UK. And alpha variant was actually around 25% more transmissible than the original China variant. And many studies shows that like delta variant cause more severe illness as well, and breakthrough infections are very common. Breakthrough infection means that if you are vaccinated, still you can have delta virus. That is called breakthrough infection. But if you are vaccinated, so the infection will be very, very mild, so you will not be sick. And in the right side, you can see the very nice diagram by CDC. So you can see that, and this is a concept of reproductive number, which, always, for example, Premier is talking about herd immunity, and we are saying that after 80% vaccination, we will open. So that is actually herd immunity. I'm not going detail because this is a technical discussion, but in simple word, you can see that one person, original strain, 1 person infect generally 2 people. But this delta variant, 1 person is infecting at least 5 people. So that is called, we call R0. That is reproductive number, that 1 person can infect 5 people, which is actually quite close to actually chickenpox. So that's why CDC recently said that Delta variant is actually very highly transmissible. Next slide. Briefly about the infection control, we use pharmaceutical and non-pharmaceutical control measures. The important are we need to find cases, then we need to isolate cases, then social distancing measures, so lockdowns like mass gatherings, then personal protective equipment. You can see on the right side, mask and other stuff. We can use hand hygiene, environmental control measures can be used. And then in pharmaceutical, we use vaccines, which are probably we can say end game is vaccine. Next slide. So here you can see transmission. So transmission chain. So for example, one is the infective case and then transmission mode and then susceptible host. Next slide. So here you can see that, for example, in case of coronavirus, now human are main host, and then through droplet, it is transmitted to the other humans. Next slide. So in each step, you can implement various control measures. For example, if humans are host, a sick person, you can isolate that person. So that is infection control for this stage. Next slide. So if to prevent the transmission, then you can, for example, use mask. So there are other strategies as well for mask, so that droplets are not spread. So that is another strategy you can use to prevent the transmission. Next slide. So to prevent the final stage, which is the most effective, is you can protect the host, that is through vaccination. Next slide. So in vaccines, my other colleagues will discuss detail about the vaccine. Currently, we have 8 vaccines licensed by WHO. In Australia, we have 3 vaccines are licensed: Pfizer, Moderna, and AstraZeneca. Different technology are being used for vaccines. I'm not going to detail, but in some case, just they use genetic material. In some case, they use spike protein. In some case, they use all virus. The only thing which is common in these vaccines are that all of them are very effective. There are 3 endpoints of vaccine: infections, hospitalization, and death. All of these vaccines prevent hospitalization and death. This is most common. You need to understand this, that all vaccines prevent hospitalization and death. In regard to infection, the efficacy is different. Some vaccines are better compared to the other. But this is very important that whatever vaccine you get, discuss with your GPs, and so you should get a vaccine. Next slide. So this is my, I think, second last slide. So just I will quickly tell you that why vaccines are important, because, for example, look at the most, my left side and your right side of this slide. So you can see that all red people are infectious and all these yellow are susceptible people. They can be infected. So for example, if you go to that, if some people are infected, if some people are get vaccination, so still transmission will ongoing. Like in New South Wales, around 50% people are vaccinated now, but still transmission is ongoing. But when more people will get vaccinated, like in the right side slide, you can see that if more people will get vaccinated, so even people who are not vaccinated, they will be protected as well. That is called herd immunity. So if we vaccinate 80% people, remaining 20% people will be protective as well. Next slide. So this is my last slide. So just quickly, I want to discuss about this within 1 minute, that what might happen next. This is very important, particularly in the scenario of Delta virus, because there are some issues. So for example, so there could be 3 possible scenarios. The answer is we don't know what will happen next. But the first scenario is that new strain will keep emerging and vaccine efficacy, maybe for the new strain, vaccine efficacy is low, maybe low, because some studies shows that for Delta virus, current vaccines efficacy, for example, for Pfizer, original vaccine efficacy was 94%, but for Delta virus, it's 88%. For example, for AstraZeneca, original efficacy was around 70%. For Delta, it's 60%. So if new strains will emerge, so there will be a problem with the vaccination. Second scenario is that natural immunity will develop and gradually the virus will wane away and circulate like common seasonal viruses. But the middle scenario, which is probably most likely, is that the outbreak will continue in some regions for a few more years, probably 2-3 years, and we will see some epidemics in some areas, and then gradually those will go away when we will get more vaccine coverage. But vaccine is end game, but we need to improve the coverage globally, because even if we vaccinate Australian students and other immigrants will be coming to Australia, and again we will see outbreaks. And last is the issue with which we have to see the future is a long-term problem with the COVID. Maybe some of my colleagues can discuss those issues, because COVID is a bit strange virus that it caused long-term problems as well. And there is a lot of research going on long-term problems with the COVID. Like, lung issues, heart problems. So that is why vaccination is really very, very important, that you should get vaccinated now. Thank you.
Thank you. Thank you very much, Dr. Chuptai. So it is quite complex. Epidemiology is not always easy. So, but you presented very nicely, and whatever simple way you can describe, you've done a wonderful job. Thank you. Hope our viewers, they will understand. And then we will encourage our viewers to ask questions later. So next presenter is our psychiatrist, and he's a senior practitioner in Bentley Hospital, WA. So we now head towards WA, so Perth. Dr. Tahir Babar Saab. So may I request Dr. Tahir Babar Saab, please present now. His topic is on mental health, and especially the impact of lockdown on mental health. So Dr. Tahir Babar Saab, please.
One of the very important area. The COVID-19 pandemic has been stressful and continues to impact our mental health and well-being. WHO, World Health Organization, include the mental health as a emotional, psychological, and social well-being. So it's very important to understand how that has been or will negatively impact and what measures can be taken to reduce the effect of COVID. What we are anticipating, and this is the research pattern, what is showing that it may remain with us for the next 7 years. So it's very important to learn about how that's going to impact on each of us, on the elder, on the adult, on the young, on the children, and as a whole construct on a whole family. So the Australian government response was quite rightly focused on the virus and zero transmission itself, but medium to long-term negative consequences of COVID-19 and impact on people's mental health may distress and suffering that could be far more than the virus itself. Next slide, please. So I will talk about the short-term, medium, and long-term impact of the COVID-19. There are multiple research have been going on, and what it shows that one of the prominent feature comes up, which is fear of catching COVID and fear of death from the virus. That's so scary feeling that is causing what we have seen about 75%, as per one of the research papers, shows that the anxiety levels have gone up. We are becoming more and more anxious. And that's a very subtle process. That's a very gradual process. We are becoming more anger out with the anger outbursts. We are getting more confused. Confused when I say what it means that we are getting more forgetful. We are not able to concentrate. And one of the very important phenomena which comes with when we experience post-traumatic symptoms, which means that we're getting flashbacks. We're repeatedly getting intrusive and distressing thoughts. We are having sleep problems. We are having inability to concentrate on our work, on our job, on our task with the family members. We are becoming more hyper-vigilant, and that all as a whole, impacts on leads to the symptoms, what we call the depression, and also the exacerbation of some of the patients who have already experiencing psychotic illness. For example, they have a major depression, or they have schizophrenia or anxiety disorders, and this is the research tells us that this has been increasing the symptoms of the existing illness. So what lockdown has caused, one of the very important phenomena, which we know from long term, is the isolation. It has led to isolate to our houses, which in turn, what has done? Anxiety, depression, again, exacerbation of these symptoms. And one of the very important phenomena which I want to bring into the picture is the increase in alcohol use and addictions. Maybe in certain communities, the people, due to religious reasons, are not using alcohol. But on the other side, that is actually their addiction is going to increase. For example, watching television on long hours, using computers. this is actually leading to an addiction. Using mobile phone very often. Like some people are actually, I've come across a few patients who are using, the kids and adolescents are using more than 15 hours a day. And that is because they are not able to go to school. They are not able to engage into the activities. They are not able to go out and play. And this is as a whole impacting on the adolescent and uni-going or children, school-going people, impacting on the education for as a whole, impacting on the family with the financial losses. Yes, the government has kindly intervened and providing some support, but that support is more likely not enough. And that is also leading to the sudden employment loss. I have seen many patients coming to emergency department when they are having suicidal thoughts because they have lost the job and they are worried about their mortgages. They are worried about how they are going to feed their family. And one of the very, very subtle phenomena, which is a work remotely, on a surface, on glancing, it looks really good that the person is sitting home, and working. But where's the work development? He's not able to engage with his colleagues, to learn, to getting mentors, and few people who have confirmed as having a COVID, for example, many people from multicultural communities. I belong to a multicultural community, and my parents live overseas. So if someone has confirmed as a COVID, catching a COVID infection, so that is going to have a great psychological pressure and disturbance on that person itself. And then how that is impacting on the personal relationships. It has a huge impact. The person used to live in a home for 8 hours at home, but that is 24 hours that person is at home. And due to aforementioned stressors, that leading to domestic violence. In the last 12 months, 6 to 12 months, the domestic violence rates are tripled. And that is going to have a huge impact on whole family, composition. The divorce rates are gone up. The situation in the family is getting worse. And these are the effects which we are not going to see just in a short term. Short term, I actually saw a patient yesterday who had a very similar effect. That because of COVID, staying at home, and that leading to the frequent argument, and now he has gone a verge to divorce. So it's very important to understand. And now the medium and long-term effects are, for example, the person, unfortunately, if he gets catches COVID infection, that will lead to and leading to the hospitalization. And then the next issue is that when he is released from the hospital, that can lead to anxiety, depression, post-traumatic. When I say PTSD, that's the abbreviation for post-traumatic symptoms, which I mentioned earlier. Again, psychological impact on the frontliners. Frontline include doctors, ambulance workers, nursing staff, allied health, and in multicultural communities, many people are actually, they belong to this cohort, this group. And economical effect, as I mentioned earlier, job insecurity, income reduction. There are many people who actually had borrowed money from the banks for mortgages, and now their pays are reduced. So that is quite stressful, which leads to anxiety, depression, and suicide. Now, suicide is a very important phenomenon. Previously in multicultural communities, that phenomenon was actually noted or reported less, but now it is getting more and more apparent and recorded and documented. What we are seeing nowadays is that I had personal experience with the one patient who actually came to me, and she was telling me that she wants to kill herself because she's worried that if she catches COVID infection, that will impact on her family members. And to save her family members, she wanted to kill herself. And ultimately that leads to addictions. And again, I mentioned the addictions that's a whole wide range of topics. That actually requires a one full webinar on this, the addictions, but no community is prone to that. If we think that, we are, or any of the communities in Australia, they will not have addiction problems. No, that's not right. The addiction can come in a very different format. And even you don't know until you get addicted to, as I mentioned earlier. So adversely impact on the relationships, as I mentioned, leading to anxiety, depression, and other addictions. Next slide, please. So I thought I should bring the university and college students issue as well, because in multicultural communities, this is a large cohort. So what we are witnessing nowadays is the periodic lockdowns every second week, every second month, which is leading to isolation. The students need to engage with the others, to learn, to develop these strategies, to develop the coping, mechanism in their life, to learn from the others. They don't want, so the children, when they are growing, their chemicals, their hormones are growing up, they want to find their identity. They want to explore who they are. And they don't learn from the home. They also need to have more, there's a huge environmental factor which comes in place, which is the other members, their friends, their peers, and leading to anxiety, depression, psychosis, poor mental states, becoming more irritable, more argumentative, more or less, being able to cope with the stresses, using the maladaptive behaviors, and losses of finances. For the adolescent going to uni, finance is the most important thing. I had a patient just I saw a couple of weeks back who was just 19-year-old from a multicultural community. She had a Muslim background, and she got she had, I think, over 10,000 she had to pay for her fee for her university. And she was working previously, but she lost job because of COVID. And that led to an increased stressor impacting on her hormonal imbalance, leading to the psychosis and ending up in a hospital. So, and of course, as I mentioned earlier, the suicide is children, they do not have coping mechanisms like adult, like my age group, but they will actually act impulsively. And addictions, as I mentioned, the computer addictions, the multiplayer addictions, multiplayer games addictions, the internet addictions, telephone addictions, these all are part of addictions. And that impact on their well-being, social well-being, mental well-being. Next slide, please. So school children, I wanted to bring in because children, we feel that they are less affected. Maybe they love staying home, but actually that's the opposite. The lockdowns have impacted on that, led to isolation, that led to anxiety. I have come across children, even 10-year-old, 12-year-old coming to emergency department with anxiety symptoms. Personal well-being, they're being affected. They are not looking after themselves. They are not focused. They are not focused in their studies. They are not focused in their games, and disturbed sleep habits. What does that mean? It means that because they know that they don't need to go to school next day. So what's going to happen? They are going to watch movies, cartoons, playing games on the late night. Aberrant diets, no regular diet pattern. It's many communities don't acknowledge these issues and the impact. But what the research is telling us, what we are witnessing, that has a huge impact. Children are getting more obese. Children are getting more unwell. Domestic violence, yes, children are witnessing more domestic violence because the parents are at home full time, and previously, they were at school or when they did not witness. But now, because they are 24 hours at home, they are witnessing this issue. Child abuse, unfortunately, no community is immune to that. It's a very high important issue which is emerging due to this condition. And I mentioned again, they may face difficulties in adjusting back to normal life when they go back to school because their whole routine is disturbed. Next slide, please. So there's another group which I want to bring into your attention is the vulnerable group. So what defines the vulnerable group? The individual that can be hurt easily physically or emotionally. And the elderly people, homeless individuals, pre-existing health issues. I have seen lots of people from different communities who have got pre-existing health issues, and unfortunately, they are being more affected because they are not able to seek the help for, and I believe that my GPs will shed a light later on this, that they are not able to actually able to seek help because they are scared that if they go to GP center, they will catch COVID, and some of them cannot speak English because being from the multicultural communities. They are more susceptible due to these above mentioned reasons. They are also, it is true that they are more susceptible to coronavirus infection. But what it leads to, poor self-care. They are getting neglect to themselves. I had my colleagues, and they are so scared.
That's all. 1 minute. So
Yeah.
please wind up now. Yeah.
So my take-home message here will be, next slide, please. So what we can do, the self-help strategies, please focus on a diet. Make a healthy diet into your pattern, no matter what. This is a message to everyone, to parents, to adults, to adolescents. Sleep pattern is very important. It's implicated in multiple mental health issues. Please make a sleep pattern, no matter what. Exercise. If you cannot go out, make ways to exercise inside home. Improve family relationships. Try to sit down, spend some time with each other in a family. Make a fun time. Play some Scrabble or some games. Hobbies. Try to find some hobbies and try to use within a home if you cannot go out. Seek help is very important. GP is a navigator. Go to GP. Ask the GP when you need help. There's a very good Medicare funded programs. Go to GP. They will lead to, they will refer you to psychologist if the things are getting, to a level. First level is where you seek help for yourself. The second level is where you seek help from the health professionals. Mental health services are very important as well and GP will be the guide, will guide you over there. But please seek help. The take-home message is, do not ignore these symptoms. If you're getting unwell, first do what you can do with yourself. And second, go to health professionals. Next slide, please. So I've just highlighted some of the numbers. There's a 24-hour lines available from your workplace, from kids lines in each state. Please do call. Just Google it and call them. They are available 24/7. So my take-home message will be just to please do not ignore mental health. Okay, COVID is going to stay, but we need to learn how to live with the COVID. Thank you.
Thank you, Dr. Babar. So you have explained very well. So it is a complex topic. And you have explained all the issue almost which are relevant in this DNA. And now this session will be open session, and I encourage all the viewers to ask questions. So we have a Q&A in the Zoom, and also in the YouTube, so you can put your questions. So we are happy to answer your questions. So while waiting for the questions from the viewers, so I just put first question about Delta variant to Dr. Ibrar Chuktai Saab, who is an epidemiologist. Can you, Dr. Chuktai Saab, shed a light on Delta variant? And especially everyone is scared. So since we heard this terminology, Delta variant, and you have briefly mentioned that it is very contagious, and one patient then multiply 5 times. And so can you just summarize again so about Delta variant so people understand that how contagious and how deadly this virus is? Dr. Chuktai Saab, please, just briefly.
Yeah, I will just briefly explain some other features of Delta virus. So this is, as we know, this is a new virus. It's emerged from India. First of all, we need to understand why these new viruses are emerging. Whenever there is increased transmission, always there will be chances of new emergence of viruses. Initially, there was a high transmission in UK, and we saw alpha strain. Then there was a high transmission, rapid transmission in South Africa, and we saw beta virus. And then we got gamma virus in Brazil, and there were high transmission in India, more than 400,000 cases per day. And then we saw Delta. So that is why we always want to avoid these high community circulation. And that is why government is very concerned about this virus. That is why they are imposing lockdown. Now, for example, some people are against those lockdowns. Let me tell you, for example, I just try to explain that. For example, one infected case infect 5 people. But currently, if you look at the current growth rate of Delta virus in Australia, it's just 1.3. So due to these all lockdown measures and all those measures, mask use and social isolation. So that is why instead of that growth rate of 1 person which infect 5 people, so now we can see the infection rate is 1.3 growth rate. So that is why these all control measures are very, very important. And the other thing is that the main transmission mode for Delta is all coronaviruses are droplet, but for Delta, there are some studies shows that there is some airborne transmission as well. Particularly in many quarantine hotels, we have seen some airborne transmission as well. And my last comment is around vaccine. So we have seen that vaccine efficacy is low against Delta virus. Almost all vaccine, generally, for example, for Pfizer, 95% for alpha strain, but 1 dose efficacy is just 30% for Delta, and 2 dose vaccine is 80 to 88%. So it is very important that you get both doses of vaccine. And you should all follow all government instructions as well, mask use and quarantine and social distancing.
Thank you very much. So next question is for Dr. Ashraf Saib. So, we got a question: why vaccination is important and how reliable is vaccination? And I will just join another question from our viewers. And the question is, there are still breakthrough infection. How the herd immunity will be achieved through vaccination? Dr. Ashraf Saib.
So first of all, I would like to thank all the participants and everyone who is viewing it. By definition, vaccine is a preparation which provides protection by stimulating person's own immune response and producing immunity. It is most effective way to protect, and vaccine strengthens immune system by training it to recognize and fight against specific viruses. Whenever we get a vaccine, then we are protected, and that way we are not only protecting ourselves, but we are protecting whole community. As we have heard in the previous discussions, that this COVID-19 is spreading very quickly and very widely, especially the Delta variants. And once people are vaccinated, so what the target at the moment government is trying to achieve is above 70 and around 80. So that once we have that target achieved, that will end up having most part of the population covered under the vaccine, and that is called herd immunity. Herd is a simple English word, means a mass or something which is done on a very large basis. So once we have most people, they are immunized. So then what previous studies have shown, they don't know yet exactly about this one, but what previous studies have shown that once most of the population is vaccinated, they will end up having less transmission and less spread of the disease. So probably, I think it will be very good idea for all of us, and it will be the one of the only take-home message for the time being. And what I will be expecting from this webinar is to try our best to vaccinate ourselves, to prevent transmission, and to achieve herd immunity all over Australia. Thank you.
Thank you, Dr. Ashraf. So next question from the viewers is for Dr. Amar Mahmood. Can you just tell us about side effects of various vaccines available in Australia? One more, I will add another question with it. So how safe they are saying is it for young people near the age of 18 to 21 to get vaccine? So just please hand over to Dr. Amar, please answer it.
Assalamualaikum. My name is Amar Mahmood and working as a GP in Tasmania. And regarding the side effects, this is one of the most common things which is asked when a patient comes to see us in our surgery. And I always tell them that one of my colleagues' brother, he's working in USA, and his brother is working in ICU. And he told that at the moment in ICU, those patients are coming who are not vaccinated. So regarding the side effects, the most common side effects which we face through the AstraZeneca is the pain at the injection sites. And sometime within first 24 hours, it is the headache, hot and cold feeling, chills, muscle pains, but usually these symptoms settle in 1 or 2 days. The most serious side effects which has been reported with the AstraZeneca is the clotting and the bleeding. So that has caused that the people whose age is more than 60 years of age, they are recommended to have AstraZeneca. And the other comes the Pfizer, and that's the recommended for the age which is equal to 18 or more than 18 years of age. And the efficacy is the same, that this vaccine gives the protection for 60% with the first dose, and with the second dose, 94 to 95% efficacy a person can have after the second shot of the Pfizer vaccine. So in regard to this age group, which is now 18 or more than 18, and now recently last night it was announced that those children whose age is 12 to 15 years of age, they will be given this chance of Moderna vaccine from the 12th of September. So the side effects are there, but the efficacy is more than the side effects, because with the AstraZeneca, out of 1 billion, only 6 people has got the complication of blood clotting. So if we compare with that one, the takeaway home message is that please vaccinate yourself, save your family, and save the community. Thank you.
Thank you very much, Dr. Amar. Next question, that's from our viewers. So I think that will be relevant to Dr. Chuktai Saab, Ibrahim Chuktai Saab. The question is that I believe in 30 to 60 days, Australia will be 80% vaccinated. What should be our life-changing habits post-vaccination or post that periods when we achieve 80%? And I will also put another question here. So still, one of the viewer asked, still we have to wear mask, or whether we get rid of the mask after 80% people vaccinated. Dr. Chuktai Saab, please.
Yeah, that's a very good question, that what will happen. So first of all, we need to consider a few things. 80% vaccination rate, this is target for adults. So for example, like in practically, this will be around 60% of student population, because children are not included in this target. So this is first, actually, you probably in few coming days, you will see another modeling which will show that probably you need a bit hard target, because this 80% is whole population, should be actually whole population. But now everyone is facing pressure for economical pressure, like UK opened as well, Israel open, USA is also open now, because they're facing economical pressure. Otherwise, for herd immunity, 80% is for whole population. But for this purpose, they are calculating 80% of adult population. So this is one thing. So I think it will take time. The other issue is waning immunity. I think yesterday or day before yesterday, a paper released which showed that for all vaccine, immunity is waning gradually. And for Pfizer, it's after 5 months, the immunity level, antibody level is 50%. So it's mean, first of all, definitely you need a booster. So after 6 months or maybe after 1 year, you will need some other booster. So this is first thing. So one thing is sure that probably the situation will continue for at least, for example, if you look at for Australia, probably we have to continue some of those restrictions for some, maybe we have to continue mask use, maybe lockdown will go away, but we have to continue use mask for at least for 5-6 more months. Finally, the last issue is, if we just vaccinate Australia, this is not sufficient. We need to think globally. We need to vaccinate other countries as well. For example, just I give you one example. Although, as I just said, that all new variants emerged due to rapid number of cases. Whenever we saw huge number of cases, a new variant emerged. If we will not control coronavirus globally, 100% some new variant will also again emerge. Yeah. Or then again, there will be, vaccine breakthrough infections. So I think this, in summing up, that is problem which Israel also facing. Like there is a question on Israel achieve 75% vaccination, and still they are getting breakthrough infection. The reason is because 75% is of adult population. Yeah. And now Israel started childhood immunization as well, and number of cases will reduce gradually as well.
Okay, thank you, Dr. Chugtai. There are so many questions now coming. We may have to extend this time if needed. So next question I will put to Dr. Amar Mahmood. So our effectiveness and safety in pregnant ladies. So there is one question that how safe among the pregnant ladies, and also safety in the children. So 12 to one question is 12 to 16, another is 18 in the adults, 18 to 21 years. So can you please answer, Dr. Amar Mahmood, please?
This is really a very important questions, because in daily practice, we used to come across the pregnant women. They are asking the same question. What we have been advised from the health department, that at the moment, we don't have any exact evidence. And this is pregnancy, even it is not recommended that it is a contraindication. What as a GP, we have been advised that we can discuss the pros and cons of the vaccine, because the pregnant woman, that age falls from 18 to 40. So definitely they need Pfizer vaccine. And so because of no evidence, we explain that, look, we can tell you that the Pfizer can cause inflammation to the heart muscles called myocarditis, or inflammation to the outer layer of the heart, which is known as pericarditis. So that is one of the nasty side effect of the Pfizer vaccine. But we can't say to pregnant women that you can't take. But if the female agrees that, okay, she understands and she wants to take the risk, so we can proceed. Otherwise, there is no evidence yet that what has happened if the pregnant woman has been given, and what is the impact on the fetus.
Okay, Dr. Ashraf, you want to add anything? Yeah. About this question? So if you want to elaborate more, so Dr. Ashraf, please.
There is a joint, I think, a statement which has come through the ATAGI and the Royal Australasian New Zealand College of Gynae and Obs, which urges all those ladies and us as a GPs to recommend vaccination in whichever part of their pregnancy they are. They have said that yes, there are possible side effects and problems, but the benefits outweigh the risks. So that is very important for us to understand.
Okay, thank you very much. And also I will add a little bit more. In UK, so they have studied cases, hospitalization, and the pregnant ladies' mortality and hospitalization much higher before vaccination. And then no, so they said that, as Dr. Ashraf and Dr. Amar said, benefits outweigh the risk. So no, the pregnant ladies, they are in the priority list. Their priority list in Australia as well, because the risk at this moment is real. Delta is very contagious. And in the pregnancy, so far, the evidence is in the favor of immunization. So risk is much less, because the risk to the health, to the pregnant ladies where the immune system is already compromised, is much higher as compared to the non-pregnant ladies of the same age. So the guideline from ATAGI, that is Australian Technical Group committee, which advises to health minister on immunization. So they also given the priority in the priority list pregnant ladies. We recommend, and I recommend also in my practice, to all pregnant ladies, whatever the stage of pregnancy, they should get immunized as soon as possible. There shouldn't be a delay. So benefits outweigh the risks. Thank you. So there are other questions coming. Let's know. One question, I think Dr. Brachtai probably will answer this. When we should expect to end lockdown in Sydney, and how many deaths caused by Pfizer vaccine in Australia and USA?
I don't think Pfizer, there's no death due to Pfizer. Pfizer is very safe vaccine, and I think there are some side effects. There are some side effects due to Pfizer, but I don't think so. Any death reported, at least according to my knowledge. Maybe there are some, but Pfizer is a quite good vaccine.
Right. Yeah.
Even for AstraZeneca, you need to remember, for AstraZeneca we got 8 deaths. Okay, 8 million vaccination, 8 deaths, and a few more clots, you can say. But you can see that in current outbreak we have around maybe, I think, 3,000-4,000 cases, and already we got 40 deaths. So you can see the proportion that, so that's why initially ATAGI said that like you should not use AstraZeneca less than 60-year-old, but now they are recommending that, because in outbreak situation, as we are all discussing, that benefits outweigh the risk. So you can discuss, of course, your concerns with your GP, but that's why government is recommending using AstraZeneca as well. Lockdown ending. So again, as I mentioned, that this herd immunity 80% target is again based on adults. The children is a big issue at this point of time, because children are circulating infection. I showed you the graph that the rate of infection is very high in young adults, and they are mainly because mobile, they are transmitting infection. The problem is the government is facing, I think, financial pressures as well. So that's why they are trying to open a bit early, I guess. And that is happening in UK as well, because they opened very quickly. And now you can see again, there are 20 to 30,000 cases are reporting every day in UK now. But one thing, my final comment is, even if we open with 80% vaccination coverage, so as I mentioned that there are 3 outcomes of vaccine. One is infection, one is hospitalization, and one is death. Okay. So even if we open, infections will continue, but there will be no death. I can't say no, but there'll be very few deaths and hospitalization. And that is what we're seeing in Israel and UK. Previously in Israel and UK, there was very high proportion of cases, hospitalization, and death as well. But after this 70-80% vaccination rate, now they have high number of cases again. But if you look at the graph of deaths and hospitalization, that is very, very low. So that is probably, that will happen in Australia as well. If we open, we will see cases probably in thousands, maybe 5,000, 10,000 cases, but there will be very few hospitalization and death. And that is probably government is targeting now.
Thank you. So next, I think is more suggestion than question, but I will just, I think I can make some question from there for the viewers. The lockdowns, one of our viewers said the lockdown has have reduced a structure in our life, in our daily routines. And that is the main reason for the harm these lockdowns are doing to our mental and general health. So what they basically want, is there any structured approach which we can implement as a community or in a family, so to help our mental well-being during the lockdown especially? This question will go to Dr. Tahir Babarsas, our psychiatrist.
Thank you.
Yes.
Thank you for the viewer to asking this question. I think this is highly important, and I mentioned in my presentation as well that you have to. There are a few things which you have to do by yourself, and three major things which stand out in certain areas of mental illness. One is sleep, diet, and exercise. But very important is structured activities. So what can be done that will help to reduce the internet use, to play games, that to spend some quality time with the family, make an allocation every day from certain hours to play, whatever you can. And our brain is a very complex organ which still continues to rewire. So puzzles, for example, Scrabble, the games where it involves the mental activity, they are found to be very helpful. So engage as a whole family, make some hobbies, try to limit to the internet use, try to limit to the games, and this make as a structure a day, so that this particular hours you are going to do this, particular hours, this kid is going to do the homework or going to go in a play. And I understand that there are multiple dynamics, can happen. For example, person living in a unit or person living in a big house, that can also make, but please do it just accordingly. The dynamics needs to be followed. That's very important. So structured activities, make hobbies, and that will help.
Thank you. Thank you very much. There are a few questions coming on. I think I can combine a few questions. And one is, how do we compare adverse effects of COVID vaccine with all other common vaccine? That is important to alleviate the reservation of many who are reluctant. And that's for Dr. Amar Mahmood. So this question, I think I'll ask you. And also they are saying, artificially stimulating our immune system through vaccination, won't that have long-term effects, especially when it is being given in short intervals? So can you answer, Dr. Amir Mahmood, please?
So regarding the first question, that if we compare with the other vaccines, so there is no doubt that all these vaccines, they can have some short side effects, and which includes, as I mentioned, that's pain to the injection site, hot and cold feeling, chills, muscle pains. But usually these symptoms, they settle in 1 or 2 days. And some of the symptoms, they do persist from 4 days to 28 days. For example, in case of AstraZeneca, that if there is a headache which persists during this even after 4 days, and which is different from the if somebody has been experiencing headache, so or they feel that at the injection site there are some small blue colored dots, which represents that there could be some low platelet count, or if they have some headache which is not going, which I have already mentioned, some chest pain, abdominal pain, or leg pains, which could be a sign of some clotting. So in that cases, yes, they can go to the emergency, and or they can contact to GP, but better to go to emergency so that they can be reviewed, and if need some special investigation, that can be done.
Yeah.
Now, regarding the that if a person who is infected, basically that person is infected, the COVID, for example, the bug, when it goes inside, the structure of the COVID, I'm giving an example because basically our main aim is to explain about the COVID vaccine also, that this COVID-19, it has a spikes, and this spike has a very special coating, which is explained in the books as a wolf with a sheep skin. And that protein spike having a very special coating, which is known as glycan. And once it enters in the body, goes into the human cell, the human body does not recognize that there is a wolf, not a sheep. So once this bug keeps on causing damage to the human cells, it represents in such a nasty thing that the death is really, really very miserable. That a person is on ventilator with no guarantee that this person is going to survive. So if we give a part of the spike, which is having a small unit, and it is given into a virus which is known as adenovirus, then it is introduced into the body immediately starts setting some immune system in the form of army, in the form of defense. So once the actual virus enters into the body, our immune system immediately comes into an action and start making more antibodies, more protective mechanism, defense mechanism to protect you from the nasty thing, which is ICU, which is hospitalization, which is death. So a person who is infected with a full bug is basically has a complete damage to the whole organ. And a person who is giving a small dose to just create a photocopy into the body, that once this bug comes again, so the immunity will be stimulated through a system which is known as B cells, which is a medical term, but just to tell you that it immediately starts making more antibodies. And we do suffer from symptoms, but not life-threatening. So this I'm trying to explain in such a simple way that coronavirus is just like a wolf in the sheepskin. So try to be very, very careful and vaccinate yourself, please.
Okay, thank you. Thank you, Dr. Amar. And we have a suggestion from our viewers that please try to avoid, technical jargons, medical terminology, make it simple for ordinary people so they understand that one. We are trying best. So please also our panelists, try your level best. So use less technical terms so that people can understand. So one question, how long headache can last as side effects after Pfizer vaccine? Dr. Ashraf, can you please answer this?
So what personally I have come across, headache can last up to 2 weeks or even more longer. But what the ATAGI, the authority on this thing, they have recommended that if a headache which is out of proportion to something which normally happens. So many people will get headaches, but they will be mild headaches, which will be relieved by taking simple pain relief medications like paracetamol. So if something which is out of proportion and something which has an associated other symptoms, including vomiting, including some neck pain, including some tightness in the neck, or some blurring of vision or photophobias, like you feel tightness in around your eyes when you go out in bright light, or if you have any weakness in the body. So those things will lead to the actual problem, which headache, why they have asked about to be careful about the headache is TTS, that thrombotic that syndrome that happens, and that causes clot in the brain, and that can lead to further catastrophic problems. Normal simple headache can last from few hours to few weeks.
Okay, thank you. Thank you, Dr. Shah. I'll just make it more simplified. What my practice is that for the Pfizer, and we have a discussion every day, I think, second, third patient ask about this one. So for the AstraZeneca, I usually ask the patients, about what he knows or she knows about that one. Then I said that, okay, look, there are venous systems. So it's a clot, if it is in the head veins, or whether in the chest veins, whether in the tummy veins, or whether in the legs. The symptom then, so what guidelines we got is that if the headache, other things last couple of days, every vaccine can give a little bit sore arm and a little bit headache. That should usually settle down most of the times within 48 hours. But for the AstraZeneca, if the symptom develop day 4 to day 42, most of the time, also some cases reported at day 52, but day 4 to 42, very important after the AstraZeneca. If the clot is on the head, think about then any headache, persistent headache, visual impairment, blurring of visions, or vomiting happen, or patient is confused, relative tell you he's not himself or herself, or sometimes fainting attack happen, or sometimes even convulsion can happen if it is the head thing. So I just want look at these symptoms, and then I tell that if it is in the chest veins, then there will be breathing difficulty, and there will be the chest pain. So you need to monitor. Don't treat yourself. See your doctor quickly. And if it is in the tummy pain and swelling and vomiting can happen. If it in the legs, the leg sores and swelling can happen, or even simple bruises if you find on the body. So you can just immediately contact. Don't treat yourself. Any of these symptoms develop after AstraZeneca, don't treat yourself. And there's another side effect which I got this one. I think which study I was just reading. It's called GBS, Guillain-Barré syndrome. That is extremely rare. And for our viewers, I will not use medical jargon. Basically, it's the immune system try to destroy nervous systems. And that is called GBS, Guillain-Barré syndrome. So that also side effects are reported with AstraZeneca. Patient can present with the weakness or even the balance problems, or with the of the numbness like things. And all that usually patient recover within a couple of months. So more than 90% it's had. Only rarely it lasts up to 6 months. And when come to the Pfizer, so Pfizer main thing is the pericarditis, mean the covering of the heart, and the myocarditis mean is the muscles of the heart. So I explain to the patient that these two important adverse effects are reported after, and usually within 5 to 7 days that's reported, what so far literature says, although it can be later, but I'm talking about the majority. The patient, I warn them that if you develop chest pain, breathing difficulty, tiredness, fatigue, so do not treat yourself after the vaccination. Speak to your doctor. So make sure the patient understand in his language or her language, so that when he can explain, to give it some patient information sheet. I make myself also for my patient, and I'll give them that. Okay, please read this and pass on to your family members, so that everyone will look at these things. If any symptom develop, so they can call the doctors. And no, I will just one question. I think Dr. Amar probably is in a good position to answer this question from one of our viewers. Is there a medicine available to treat COVID patient?
Not yet. A lot of medicines has been tried, and a lot of are available on Google Doctor.
Yeah.
But there is not yet any approved or recommended medication.
Yeah.
The only recommendation is vaccination, which we will say that please proceed for that one and take it as a take-home message, please.
Right. Thank you. So that's a very good answer. The only option is vaccination, and of course other measure which we discussed. But I had two patients just day before yesterday and also 3-4 days back. They wanted me to prescribe, although it's not under the Medicare. I thought it's not PBS, and this is for the parasite. Ivermectin. Yes, ivermectin. So I never prescribed in Australia that one. I told her, oh, no, I will not prescribe because I don't know this one. That he just, one patient was male, other was female. They quoted a professor that who prescribed this one. Then I went on the TAGI, that's therapeutic good administration. And then I brought information for this and showed to my patient that is the recommendation. They said there is no evidence that this treatment is successful in treating. So there is no evidence-based that this medicine is helpful. So there are other also options. Vitamin D also, people say that there are some evidence they support it. It help your immune system, but there is no evidence that is effective. But as compared to the placebo means just sugar coated any medicine. But anyhow, so if I will see if there's any other question, and that I think there's another question. Artificially stimulating your immune system through vaccination won't that have long-term effects, especially when it is being given in short interval? Dr. Chuktaisa, please.
So okay, so I think we already discussed about vaccine. We have been using various vaccines since last, I think now more than 100 years. As a I think Dr. Amir and Dr. Ashraf also explained about the vaccination mechanism. So what we are doing, that we are using essentially the same pathogen. Like in my slide, I showed that either we are using DNA of small component of that virus, or we are using spike protein of that virus, or we are using a whole virus. We just kill that virus or somehow chemically treat that virus to weaken that virus. So these are three most common mechanism of creating a vaccine. So essentially, vaccine is basically using your own body. So like, for example, whenever a pathogen is weakened and enter into your body, so your body create antibodies against that pathogen. And that is actually, although this is artificial immunity is created, but the mechanism is the same as like of the natural immunity. Like, for example, like for coronavirus, if coronavirus enters in your body will create antibodies to defend coronavirus. So in case of, for example, this Pfizer and Moderna, we are just using mRNA. mRNA is a kind of genetic code. So they enter code in your body, and your body create those spike proteins, and then your body again react against that spike protein, and antibodies are created. So essentially, it is not kind of any, you can say it's a very kind of abnormal system. So essentially, your body is creating mechanism system. And most of the vaccines we have seen that those vaccines are safe. Like, we have been using measles, mumps, rubella. We are using hepatitis vaccine, influenza vaccine. So all those vaccines are safe. There are some side effects of course, like, because these are not natural components. But again, their benefits outweigh their risks. So this is most important. Like, for example, before measles introduction, there were thousands and thousands of deaths due to measles. But now after vaccination, probably there will be 1 or 2 maximum deaths in maybe 10 years or 20 years. So again, you have to balance the benefit against the risk. Similarly, with the COVID vaccine, for example, you are saving, I think, I'm not exaggerating, you are saving millions of lives with COVID vaccine. If like due to some reason, if like few people die, so although this is very unfortunate event, we are always, our sympathies are with those people. But the thing is, again, you have to balance benefits against the risk. So benefits of vaccinations are really very high. So we should consider vaccination.
Thank you very much. There are a couple of more questions, and then we will, I think we'll close it. So we already extended to 15 minutes, maybe another 5 minutes, we should close it. That question for Dr. Amar Mahmood: which vaccine is best for people with disability, like at risk of fall or their balance problems? So, or people who have heart disease and diabetes, which vaccine is best for these people? Dr. Amar?
Yeah, so basically the criteria for the vaccine is age related. That's 16 and more than 16 recommendation is the AstraZeneca. Yeah. And from 18 and more than 18 till 60 is the Pfizer vaccine. And now recently recommended that from 12th of September, it would be 12 to 15 years of age. The only contraindication which is found that if, for example, a person is showing anaphylaxis to any one of the this group, or there is a history of clotting. Otherwise, if the person has diabetes, hypertension, kidney problem, on immunotherapy, chemotherapy, CCA, congestive cardiac failure, heart issues, asthma, anything, there is no contraindication for that vaccine if they fall in the age group of that group. If, for example, a person was given the AstraZeneca and that shows some anaphylaxis, so they are recommended to have the Pfizer vaccine in that group. Or if a person who was overseas and got any vaccine which they don't know, or they have got one group, so if they come here, they can take the other this brand of the vaccine. Otherwise, there is no issue with the disability, no issue with the other immune suppressant, except there is a clotting problem. And in Pfizer cases, if somebody has an acute rheumatic fever, or within the 6 months have the issue with the form of inflammation to the outer covering of the heart, which is known as pericarditis, or inflammation to the muscles of the heart, which is known as myocarditis, or the inflammation to the inner lining of the heart, which is known as endocarditis. And if needed, the idea is that call to the cardiologist, talk to the immunologist, and involve the GP, and then go for the vaccine. Otherwise, there is no any other contraindication.
Thank you very much. Just briefly, one question, if Dr. Ashraf can answer this. Is it advisable to have a daily aspirin? So well before having Astra to reduce the risk of clotting?
There are no such suggestions by any of the authorities.
Okay.
People were taking this for different preventative measures in the past, and those are also proven to be not very effective, like in prevention of stroke and heart attack, and then in prevention of other things. So it's no more like recommended as a prevention of anything.
Right.
And there are no such studies which tells us that yes, it has any proven role or efficacy.
Okay.
Thank you.
And the next question, I think from our viewer, one of the viewers, instructing, I think that will be relevant for Dr. Chugtai. Instructing cells through mRNA, that's the messenger RNA, is something not tried before. Do you think that might have unforeseen consequences? Just briefly.
Okay. Okay, I will explain it try to explain it very in a simple way. You know, messenger RNA, it's not a kind of, I can give you a very layman example. Like, for example, it's a kind of, for example, if you want to make a cake and you have a recipe book. So messenger RNA is just a recipe book. So it is just to instruct your body to create spike protein. That's all. And once it enters in the body and it creates spike protein, it are automatically destroyed. There is no chance. Of course, like first of all, of course, like, humans' knowledge is limited. We don't know. Maybe something happen in future. But as far as we know, messenger RNA, if we were not injecting in the body whole kind of new DNA or RNA, it's just messenger RNA. Messenger RNA is a kind of, as I just mentioned, it's a kind of recipe to make a cake, for example. So once it gives signal to the body to create protein, it automatically destroy. And then your body create spike protein, and then your body react against those spike protein and create antibodies. So it's a very, very unlikely. And the last, I will just give a small comment that this is not a new technology. Many people believe that this messenger RNA is a new technology. It has been used in many other indications previously as well. More than, I think, 15-20 years research have been ongoing on messenger RNA technologies, using in some drugs and other areas.
Thank you very much. I think that's a very good explanation. I think that satisfies our viewers. And one more thing regarding the mental health, I think we go to Dr. Tahir Babar Saab. So what is the difference between counseling, CBT, and other psychotherapy?
Okay.
There are different psychological tools which were relevant for some person, other psychological tools relevant for other patients. And they are not talking about medication. You, Dr. Tahir.
Yeah, thank you. So first, counseling, that's not under the Medicare funded program. This is a unstructured program, which the counselors who have got various, that can be a variation from 6 months to 2 years diploma or 3 years, with the masters, that mainly counselor focuses on here and now. The situation that they will discuss, there is no structure compared to CBT, which is called cognitive behavioral therapy. Cognition means, your thoughts and feelings, and how that affect the thoughts lead to feeling, and how that affects to behaviors. So they all are interconnected. And this is a structured therapy, and depends on what kind of modality is used. But mainly is that varies between 12 to 25 sessions, where therapist actually works with you in a very structured way. They have got a formulation, means plan beforehand with you. They discuss the plan with you, and then every session they do work. They will give you a homework to take home, and they will actually check the homework next time when you go there. So that is more of structured therapy. There are other therapies as well, which are structured. So counseling is quite helpful, beneficial. For example, grief counseling, that if someone has lost, some very important, sometimes it's not that losing a person, it could be losing like coming from overseas here in Australia, losing their culture, losing their identity. So, and that could be short, that could be 6 sessions, that could be 10 sections. And there the person can discuss about the stressors. For example, couple counseling, the family, the whole family counseling, they are not structured, and they are more of supportive measures. But the CBT, there's another therapy which is called dialectical behavioral therapy, DBT, acceptance commitment therapy, ACT. So these are the therapies which are structured ones, where that needs to be a psychologist. They are under the Medicare funded, and GP can make a mental health plan. And so first thing is to go to GP, please make a mental health plan. And there are 20 sessions. Each state varies, but there are mostly 20 sessions which are covered by the Medicare in a 1 year.
Thank you. Thank you. Thank you, Dr. Tahir Babar. And I think we reached also, there is a few more questions coming, but we can't continue anymore. So it's already, I think, half an hour. We want to finish another 5 days. One more question, which I think Dr. Brar can quickly answer so that we will not disappoint our viewer. Question is, how many days vaccine mRNA remains active in human body cells?
Just briefly, as I already explained, that mRNA is just to start protein synthesis process in your body, spike protein. It is just to create spike protein in your body, and after this it destroyed. So it will not stay, it will not change I understand your main concern is that probably it is changing your DNA. This will not happen. This is just to start protein synthesis process, spike protein process in your body, and then it will go away. I'm not sure about the exact days, but definitely it's very short time.
Okay, thank you. Thank you very much. I think that's conclude our webinar. So I'll just briefly touch few things, and the take home message is that Delta variant is deadly, contagious, and it's real. Some people, even some patient asking, is it real, this virus? I think they have seen now in Sydney, and they have seen at home all these things. They have seen their loved ones in the hospital. So people are more hospitalized, and many people are in ICU, not far away. So in our home, in our Sydney, so in our other states also. So just take it seriously and follow the government's rules, and make sure you have good practice. And especially the multicultural community, sometimes it's very, very hard to send the message across it, and follow all the rules, health order especially. Safe social distance, separation is very important. That separation means that it's a social distance, and also do not unnecessarily visit other homes. And when you go even for the charity, make sure you practice the social distance, make sure you have a good hygiene practice. And also another thing important in the prevention is ventilation. So in your houses, so keep your houses also, if the window a little bit open also. And the ventilation studies has shown that also slow down the spread, and you can also prevent the further passing to your loved ones. And then there is a vaccination role is equally important. So vaccination is the right way, and there is at the moment all studies, all countries, it's not one country, all countries, they follow the same thing, that if you want to open your country, so you have to go through this herd immunity, whether vaccination or somewhere. So main thing at the moment in Australia, there are 2 vaccines available. Third one is coming in a couple of weeks' time. So do not wait, do not unnecessarily delay the vaccination. Vaccination protect against the Delta variant. Even if it is 60% effective, if it is even 70%, doesn't matter. So it will prevent, many complications, and it will prevent hospitalization. It will prevent the ICU admission. If you have witnessed ICU life, if you have seen on the movie or other thing, so horrible life. The patient, it's lying in the bed, no other, all the machine is giving the, oxygen, and the tubes there from everywhere, from the nose, from the, for the catheter. So a lot of miseries we can avoid easily, at least whatever available, what God has given IQ to human beings, and research-based, evidence-based, the advice is given that vaccination is very, very effective. So AstraZeneca will also be is equally effective in many cases in preventing the hospital admission and severity of infection. So if any chance you can't get the Pfizer, if you are in that age bracket, consider about AstraZeneca. Consider that your risk factors, how likely you get this Delta, because having a Delta and chances of ending up in the hospital is far, far more, the worse consequences as compared to the rare risk with the AstraZeneca of the clotting or GBM or any other, the minor symptoms. So there are very, very these rare side effects. With the Pfizer also very, very rare side effects. And in these days, we have a good protocol to manage these side effects. We have know what blood test is required to monitor the side effects if some patient present there. And it can easily treatable if it is picked up quick. Don't delay it. Don't delay it. That is the message. And if you develop any symptom, any signs, see your doctor, speak to your doctor. And we have a protocol, and we have prevented many, this AstraZeneca related clots. We picked up early and treated quick in the Australia I'm talking about. And in the also Pfizer, rare side effects on the inflammation of the heart muscles or covering of the heart muscle, extremely rare. And it is usually easily treatable, and very rare chances that the patient need hospitalization. And there are tests like X-ray, there are tests ECG, there are troponin. These are the blood tests also. Easily we can in the GP can manage these the screen with the blood testing, and give you reassurance that that is not the case, and that reduce anxiety. And consequences of lockdown and this pandemic is the mental health issue is a reality, is a big issue. If somebody is not coping well at your home, do not stay home. Always speak to your health practitioner, your GP. And it's as Dr. Tahir Babar said, we have very structured approach in Australia. It is exactly the same practice as NHS in UK, and we follow their family practice. GP knows you, your circumstances, and your family history, and all your relationship, everything. All GP understand that one as a whole person. Very, very holistic approach normally we adopt in our practice, and then help you to come out of any anxiety, stress, depression, flashbacks as mentioned, PTSD, and anxiety related to this school from home. There are so many things Dr. Tahir has very, very in a simple language explained, and also explained what the difference between psychologists and psychotherapy and also the counseling. It's excellent services available. I haven't seen such services in UK where it was nightmare to get appointment with a psychologist. Here you get psychologist appointment in Australia within a few weeks, sometime within days if we request them that this is urgent. So speak to your doctor, and your GP is equipped with all the material, and they know that which service you need at that time when you need it. So at the end, so we pray that may Allah so remove this pandemic from all over the world, and remove the suffering of humanity. And humanity first continue to put efforts to serve the humanity. So humanity first is for you and for the service of mankind. It doesn't matter whether you are Muslim, non-Muslim, or whether you are from whatever the background. So humanity first is doing wonderful job at the moment. At the moment, Sydney is helping the people who need food, who needs winter clothing. At the moment in Victoria is happening, activities going on. In Adelaide is also going on, and other states also not far away from their activities. So it's a fully functional law in Australia. We have also medical director in the Humanity First, who has his own team. So they can guide you if you need any help. You can Dr. Tahir Babar Saab, our psychiatrist, and Dr. Amar Mahmood is a director of Humanity First Australia, medical director. So he can also help you. We can also help you. So please do not stay quiet if you have any illness related to mental health or related to vaccination related or anything. So Humanity First is with you, and whatever in our capacity and ability, we will help you. Thank you very much. And I thank you, Dr. Noor Aftab Saab, and he done a wonderful job. He organized, he's behind the scene, and Numan Saab, who's engineer. So our director marketing, and then I have, what's the name? Our two other members at the moment, Ammar Khalid Saab. So he's providing a technical support. Thank you very much. And thank you, panelists. Thank you, our presenters. And of course, our viewers, I thank you very much for joining. Hopefully, we will bring you the new webinar with the different topics. So in near future. Thank you. Assalamu alaikum wa rahmatullahi wa barakatuh.
Alhamdulillah, barakatuh.
Okay, assalamu alaikum. So we leave the meeting.
बहुत बहुत जबरदस्त